now is the single best time I've ever seen to build digital health. The role of a startup CEO is to sequentially replace all of the tasks on your plate with people who are better than you at those specific tasks. Present vintages of VC-backed healthcare companies will be some of the strongest in U.S. history. Holy macaroni, we feel stupid for having ever practiced our particular corner of medicine without Alex's whiz-bang widget to focus on unit economics for your customer. And if you're designing a venture that doesn't, that's on you. That's just because you didn't do your homework. The throughput and energy when you have a team that functions that way is just fundamentally different.
Hi. Welcome to our new episode of Digital Health Interviews, and I'm super excited to introduce our today's guest. His name is Vadim Gordin. Hi, Vadim.
Hi. How are you today?
I'm doing really well and really excited about our interview.
Great.
Let's start with your short introduction. Please tell us a bit about your background.
Sure. So I'll tell you where I'm at now, and then we'll work backwards.
Okay.
So I lead a healthcare venture studio, and called Flax, Future Labs A venture studio at NYU's Engineering School, and also a industry agnostic accelerator called Catalyst, also at NYU. And then before that, I was a multi-time founder. All of those physical devices related to healthcare. I've raised twice, exited once, small exit, but still. And then before that, I was a patent attorney and a biomedical engineer. And yeah, I've been in various forms of healthcare since about 2012. And yeah, worked with a lot of different customers, done a lot of different types of product, and happy to share the things I've done the way.
Awesome. How do you spend your time right now between accelerator and
I'd say it's probably... So the other hat that I wear is I'm associate director for incubation and acceleration at the engineering school here at NYU. So I'd say it's about even thirds between crafting new companies for the venture studio and then supporting those, helping to the day-to-day is largely handled by, we have an excellent program manager named Netta who handles most of the day-to-day of the accelerator, but working on that. And then also the last third would be the support for graduate students and for faculty members who are looking to commercialize their inventions.
And are you an advisor on the advisory board for lots of them?
I tend not to like formal advisory boards for companies because particularly as they're going from idea stage to 0 to 1, the needs change so rapidly that like if you have a fixed group of, call it like 5 people, 8 people that you're pulling into a room once a quarter, the people you'll need for the startups that I'm working with, they'll need one quarter versus the next are so different that I generally don't like when they have advisory boards, but I'm an advisor to quite a few companies. So we have a graduate student facing accelerator that runs 12 teams at a time. Our Catalyst runs 12 teams twice a year in cohorts, and then the venture studio launches 4 companies at a time. And there's a bunch of also just graduate students and faculty members that just come in anyway for support. So yeah, I advise quite a few companies, and I'm also an advisor for both the New York and the Fort Worth Tech Stars focused on healthcare.
So before you became an advisor and mentor, as you said, you are multi-times founder of your own startups. Mm-hmm. What are the main lessons you've learned from being a founder?
Couple things. Single biggest thing is to focus on unit economics for your customer, particularly when you're selling to enterprise customers. And I posted this on LinkedIn a couple of days ago as well, is that the single biggest differentiator I've seen between first-time founders and multi-time founders is the multi-time founders from the drop are thinking about how their offering impacts the unit economics for their customers, right? Like if you cannot clearly communicate the business case for why like the employee or the executive or the administrator at your client is going to be a hero the day after he brings your thing on board, and I'm talking about like either the COO or CEO or CFO, give the guy a promotion the next day, then chances are you're running around with a solution in search of a problem. So that I would say is if I had to like boil it down to a single thing. Another thing is just like recipes for founder pairs. I've been, at this point, like 12 years of startups, I've only met 3 or 4 folks who could genuinely be solo founders. In general, I think that the 2 roles you need in a startup are you need the founder who brings the fireworks, does the biz dev, ideation, etc., and the founder who makes the trains run on time. And those 2 roles have to have a deep mutual respect for one another. But that to me is my like critical mass, my like, absolute like smallest indivisible chunk of what it takes to make a functioning team.
But the second person cannot be hired? That should be a founder? I think
they can be hired, but just a hire brings a different sort of energy, right? And this was my big realization during COVID. I did 2 projects related to PPE. And I'd had plenty of employees in the projects I'd worked on, some decent, some not. But when the lockdowns hit, everybody's startup got paused. And we started here, I was actually volunteering here at the Future Labs as just an EIR at the time, and we developed a face shield together with Joe Borello of Mount Sinai's biodesign team. Did a lot of things right. And so because of that, it became the #1 result on Google for open source face shield for a long time. We had 60 major groups manufacturing. I'm sure there were lots of other smaller ones. Mount Sinai, when they evaluated all the open source face shields at the time, they picked ours and one other one to recommend for system-wide use. And so we had lots and lots of demand, and we initially we went out and got donors, and we distributed face shields for free. And then like you call up the donor and say, hey, I need $100,000 because this health system in rural Pennsylvania needs face shields. And I'm like, all right, cool, let's do it. And then, the next week a nursing home calls up and you call up the donor and it's like, hey, can I get another $25K because there's this nursing home that needs help. I'm like, man, I just gave you $100,000 last week. And so we realized very quickly that for that to be scalable and for our impact and our ability to protect clinicians to be genuinely scalable, we needed to generate revenue from the face shields and isolation gowns we developed. And so my co-founder and I pulled in a lot of folks who we'd like worked shoulder to shoulder with. Right? It's like you go to these meetups, you collaborate, you see other founders that are building. You're like, man, I'll do something with Jim one day. We get on really well. And so I pulled in the exceptional founders that I knew. And so I was on the face of it, I was the CEO of the thing. But the reality is that the thing I realized is I'd never had a team of genuine, exceptional operators. And the throughput and energy when you have a team that functions that way is just fundamentally different. And it's funny because like that was when we went. So we did one project related to face shields. We then pivoted to isolation gowns, where we worked with a bag manufacturer in Jersey City who had previously worked with the garment and the restaurant industry, where we customized his production line, and then we paired him up with another one of our production facilities who was a tier 1 auto manufacturer to make isolation gowns. But at the end of that, I realized that I, as an operator, would never be as good as my friends that I'd pulled in, who were truly exceptional operators. So part of my thesis here is to find and support those genuinely exceptional operators. And there's it was sort of like a freeing sort of realization. But I would say that like the energy that someone brings when they're a co-founder is fundamentally different than the energy that someone brings when they are a employee, #1. #2 is that the ability to solve problems for those as a startup founder, you should be, even if you are not at that like exceptional operator level, you should be trying your darndest to find those extraordinary operators who do the role better than you. And that's like, if you step back and say, well, what's the role of a CEO as a startup grows? Well, the role of a startup CEO is to sequentially replace all of the tasks on your plate with people who are better than you at those specific tasks.
This is really interesting. But I said, let's kind of narrow down our conversation into digital health specifically.
Sure.
What are the main challenges right now you can see for startup founders in digital health?
Honestly, I think that now is the single best time I've ever seen to build digital health.
Interesting. Why?
One is that there's a thriving and robust international ecosystem of operators who have done the thing at scale. And you say, look, I'm looking to talk to folks who have rolled out at the $100 million or billions of dollars level care programs related to pick a space, primary care, obesity, asthma, whatever it is. There are exceptional operators to learn from. Like, if you as an operator are not finding those folks, that's on you. That's not because the connections don't exist in the ecosystem. So one is there's fantastic levels of just clear knowledge transfer, number one. And honestly, part of what I try to do with the events that I host is to create vectors for that knowledge, for the knowledge transfer, number one. Number two is that there are ready and willing investors who are willing to write first and second and third checks into teams and asking teams for reasonable traction to get that money, number two. Number three is that the health system operators are, at this point, they have processes for dealing with startups, both health systems and health plans. Right? It's not like 2015 where a startup would come to a hospital and the hospital would expect that startup to behave as a much more mature company. Right? There's programs and systems in place for piloting and getting to that first revenue. Some systems takes longer than others, but in general, whether you're talking about a PE-backed primary care roll-up or like SUNY Downstate or even NYU, like there's all those places have a defined way to bring in a team if that team is bringing a value proposition that actually matters to decision makers. And the constituents who we serve, right? So there's the health plans and the actuarial overlords that we have to answer to in terms of paying for our widgets, right? There's the health systems, there's the patients, there's the actual providers. Like, all of those constituencies, for a founder who's willing to do the homework, you can get at exactly what matters to each of those. And if you're designing a venture that doesn't, that's on you. That's just because you didn't do your homework, or you're choosing to imagine the world as other than it is. But the messaging and the knowledge is there to be had in terms of how to build correctly for these constituencies, and they're ready and willing to contract with teams that can actually improve the outcomes that matter to them and the both top and bottom line and operational outcomes that matter to them. So, and then the last bit is that there are experienced operators. So, like, there's been several cycles of funded health tech startups. Some have done better than others. But, like, you go into the New York City ecosystem, and there are, like, we just had a talent mixer with Oriana of Women in Health Tech. Like, those resumes were very, very strong. Like, it is not difficult presently to find high-quality operators for whatever side of the healthcare equation or spectrum you're trying to work to. So I think that those four things combine to make for, I think, a very healthy ecosystem for healthcare startups. And something that I've said to a number of my peers, and I'll say to you here, is that I think that the present vintages of VC-backed healthcare companies will be some of the strongest in U.S. history.
That's good news, right?
Yeah.
Okay, so you mentioned that right now hospitals and healthcare systems overall, they better understand how to work with startups.
Yes.
What would you do as an operator to make sure the integration of your healthcare solution into the health system goes smooth and efficient?
I think it's a loaded question. Right? I think the question you should be answering is, how do I make the lift from the part of the health system effectively zero? Right, like, you've got folks like Rick Renard of AWell. You've got folks like Yair Saperstein of AVOMD, who literally make their North Star that change management should be effectively zero. And so literally, like, the goal that they give their tech teams. So Yair is a former primary care physician. Rick is a former nurse practitioner out of Belgium. Like, they understand what clinicians want, and they make it a point to build out their solutions in such a way so that when someone at a health system says, or a provider of any scale, right? I don't care if it's a four location dentist or a 20 location PT provider or a rural hospital, when they say, yeah, let's do this, that first moment of magic of like, holy macaroni, we feel stupid for having ever practiced our particular corner of medicine without Alex's whiz bang widget. Like, how could we possibly go back to working without this ever again? Like, that's on you. And like, the change management has to be effectively zero. Like, the amount of human lift required to get to that first realization of like, man, this is practicing in our area of medicine is different now than without this.
That's the most challenging part, right?
Yeah, absolutely. And to be fair, like, Epic does not make it easy, right? The health plans do not make it easy. But at the same time, like, the administrators, they just don't have any bandwidth for your bullshit. They just don't. Right? So my parents are physicians. My wife's a physician. Like, I know many administrators and many different styles of healthcare providers. Like, they're being squeezed by the various constituencies that they need to answer to, and the amount of bandwidth they have to mess around with their tech is zero, number one. And number two, there are so many startups building various solutions that whatever your service offering is, chances are they'll find the one that's going to make it easier for them to get to that first bit of magic.
Tell us more about Future Labs, the concept, success stories.
So I'll give you broadly. We were established in 2009 by the city and the state. This is when New York was not the startup hub that it is today. And they basically said, look, we need incubation, acceleration, but tied into the excellent academic institutions that are here. And so the Future Labs has gone through several iterations, but basically since 2009, we've worked with over 300 companies who've gone on to raise $2.7 billion in venture capital and had 43 exits. And it's always been cohort driven, so 10 to 12 companies at a time. And there's the standard workshops that I would think most accelerators have. I think the thing with the Future Labs is that, one, we have a huge, very broad university to draw from in terms of both alumni that are in various industries and faculty members of various expertise. Two is that everyone who's ever been in my role has been a builder first. That there's not really career academics doing this. Like, I know how to build, how to ship product, and how to sell. And the folks who came before me know how to do so, and the folks that we hired into like program manager roles know how to do those things. And so I think the type of coaching, the type of mentorship feels different. At least when I came here initially, just as an EIR, I was volunteering here, mentoring healthcare and hardware companies. I was like, man, these are different sorts of folks than I had previously worked with at other accelerators, and those folks are still. 5 years later, I still have a very warm relationship with them, and 3 years ago they brought me on board. In terms of, I'll give you an example. So we had a company right when I joined that was where the founder they'd gone through our seed stage program. They were looking to raise a $20 million Series A, and they came to my still boss, Craig Wilson, and they said, hey, we've got these 3 competing term sheets. What do you think about this? What do we do? And two of the firms that had given this company term sheets, they had previously invested in other Future Labs companies, and one of them had just had an exit. And so Craig connected exited founder with currently raising founder. And they talked through, hey, what are the moving pieces? What was it like to actually work with this group? what ended up happening was that the older founder chose to put in his own money into that round. He got the current founder unstuck, and then the bingo bang, the deal got done, everybody's happy. And they're just like, having been in the New York City ecosystem and operated at a fairly sophisticated level for a number of years, there's a connectivity here that is hugely helpful, I find, to teams. To like the breadth of NYU, in the venture studio, one of our first companies, it's a company called Vital Audio. So we built the team, we helped the founder find the original problem statement. We were the first funding in when it was still a problem statement. It's a algorithm and a series of algorithms that is capable of measuring heart rate and heart rate variability over a conventional phone call. And Nimitsa Calvin, the founder of that company, he needed help getting the math to work. And he's like, okay, engineering school, let's go to the DSP folks, right? Their suggestions didn't quite pan out. We went to the School of Medicine, like data scientists, cardiology, yeah, we got all those, right? Didn't pan out. School of Applied Sciences, didn't quite pan out. The guy who got the math to work, who was his co-inventor on his patent, is a composer/data scientist named Tae-Young Park from our School of Performing Arts. And that's the kind of stuff that like becomes possible. And there's so much breadth here that there's the bench that we can draw from for any given discipline is so deep that just allows for a different, we'll say, type of connectivity that's possible elsewhere. And it's a point of privilege, right? It is something to be, I think, respected and to be humble about, but it's here, and so we deploy it to create unfair advantages for our teams. And the same thing goes for students. So we deploy both into venture studio companies and into our accelerator companies, students from both the regular school and the honors program into our startups in both paid and unpaid roles, and a number of those have kind of turned into full-time roles. And it's the sorts of opportunities that I would have killed for when I was an undergrad or a graduate student. And again, it's just a question of we are in a position to provide highly valuable connectivity, and connectivity that's deeply valuable to both the students and the founders. And so just when you can do that, it's a blast.
And I think you also mentioned that you are looking for some problems to solve as well.
Yeah, so in the venture studio, I actively go out to health systems, to health plans, to publicly traded companies, to physicians, and find problems to solve.
And then what?
So, like, perfect example, we have a project right now with Memorial Sloan Kettering, where they have exceptional R&D in the data science universe, in the pharma R&D universe. And so I reached out to them and said, hey, I have lots of electrical and mechanical engineers. Do you have problem statements that we could build? And there's a thriving, very healthy project around an implantable device for cancer that we're developing together with them that was based on just, hey, here's where we can come together and build something really cool. We have a device that came out of the venture studio called CareRhythm, where it was, the initial problem statement was the chair of vascular neurology at Langone had an idea for an implantable stent, and the stent would sit in the patient's carotid post-stroke, and it would monitor minute changes in blood oxygenation as the blood flowed past and went up to the patient's head, and based on that, it would zap the carotid body, so a little bundle of nerves at the bifurcation of the carotid, that would then affect dilation and constriction of the blood vessels in your head, so affect cerebral blood perfusion. And that was brought to us as a, hey, can you build this? The answer is no. There's a number of reasons why not. It's nice because in the New York City ecosystem, again, there's the expertise that's out there. There happens to be a team at Deerfield Catalyst who has done a bunch of projects related to ablation of the carotid body and the carotid sinus. And they had developed devices that they had asked vascular surgeons to implant. And there's a bunch of reasons why that tack is very difficult to pursue. And so we stepped back with this physician and said, okay, well, why is this important? What are we trying to achieve here? And once we got to that, what we came to was there's a research lab here at NYU that has done years of research for monitoring blood oxygenation in people's feet for peripheral artery disease. So like late stage diabetes, etc. They have various neuropathies in their feet. They have terrible blood flow in their feet. And there's a bunch of reasons why you want to monitor that. And so we put that lab and this vascular neurologist together and said, hey, could you guys achieve what this guy wanted to do with a stent, minus the zapping bit, using an adapted version of this peripheral artery disease technology? And so we hired a master's student to work in that lab, became a venture fellow, and alongside a PhD student there. They did exceptional work. So the master's student, who's now a PhD student, his name is Lokesh, and the PhD student, her name is Nisha, and Lokesh Sharma and Nisha Maheshwari, and they developed a device. In 14 months, they went from problem statement to completing a 15 healthy subject trial at Langone, which is a significant lift. And the promise of what they're doing is that after a stroke, at the point of discharge, a nurse would apply a patch to a patient's neck that would sit on the patient's neck for 30 days. And the monitoring that it is capable of blood as it passes through in the carotid is so minute that they believe, and this is with the support of lots of neurologists and lots of data, that they can capture recurring strokes before they occur. And so they have a lot of cool stuff they're developing after it. But that project went from problem statement to completed 15 patient pilot in under 14 months. They won top prize in the health tech venture competition across all of NYU. So NYU is $1.2 billion of annual research. They won top prize for healthcare ventures across all of NYU this past year, and they're off to the races. And so that's a project that's what I mean when I say that we look for problem statements and we initiate projects. And it's more of a convening, and then we have a small amount of money that was a gift from an investor named Fred Wilson, who's a trustee at NYU, that I deploy to hire folks like Lokesh to build these things.
So how did you select specific people to be basically the main researchers and founders, right? They're founders.
It depends. So in the case of Vital Audio, like the say and it measures your heart rate and heart rate variability. And I'm happy to share this publicly, my standard test for a CTO is a algorithm called Eulerian video magnification. And what that is in 2012, some very smart folks at MIT came up with some math around, we're going to look at a person's face, and based on minute changes in the colors of their skin, we can calculate heart rate. And so when I was interviewing for that role for the CTO of Vital Audio, I put up a job post on our graduate student job board saying, hey, we're looking for a CTO, for a CTO venture fellow, is what we call the role. I got about 150 resumes. I'd say 75 of those were folks that I spoke to, and all the folks that I spoke to, I said, look, the test for this is you implement Eulerian video magnification into a Zoom call. Here's the Git from the 2012 MIT paper. Here's their paper. Let me know when you're back. So I've done that now many times. I've never gotten more than 3 people getting back to me with actual executed stuff, implemented rather. And again, we're solving for exceptional humans.
So I get with the technical part, but when you're looking for a CEO, what was the task for?
Similar. There's the thing I'm looking for. If you want a framework for it, right? There are certain folks who, if you lay dots out on a piece of paper, can connect those dots. For me to be an effective first 3 or 4 people into a startup operator, you need to be able to look at a blank sheet of paper and lay the dots out on your own. So depending on the specific task that we're talking about, I have similar asks of folks. And listen, part of that's just like an executive function and time management thing. Like, so at this point, I know that it takes three or four nights for a high quality programmer to implement Euler and video verification into a Zoom call. Someone does or does not make that time. I intentionally don't give them I don't give them a deadline. I don't say, hey, this has to be done by May 2nd. But they're told, I'm having another 69 of these 15-minute interviews, or 50 of these 15-minute interviews. Everyone else is getting this task as well. And for a certain type of founder, that's going to light a fire under their tushy, and for others, they'll watch a soccer game.
Kind of to wrap up this conversation overall, apart from Future Labs, can you draw a portrait of characteristics a founder should have to make a successful startup?
A couple of things. I've thought a lot about this, and it also it's both in terms of what I've seen work and also my own limitations. Mm-hmm. So one is I think they have to be natively curious. Mm-hmm. Generally, when you talk to folks, there's a guy here named John who's got a great company called Pickle that does HR, where he told me that he's a PhD physical therapist, but at one point he took a career break because he built out a Toyota 4Runner and built a gourmet kitchen into the back so that he could have gourmet meals while he was camping in Colorado. Right, it's these bizarro I did this /this just purely for the F of it because I was curious. I would say the overwhelming majority of effective founders I've met have a story like that. To the point where it's not surprising anymore. So they have to be a self-starter. They have to be curious. There's also, I think, especially in healthcare, people are just on a spectrum of either focusing on viewing the world through the lens of what's wrong versus what's possible. You need to skew further to the right on the what's possible thing. And the other bit is that they need to be able to both convene high quality operators, they Pied Piper style, they play their flute, and exceptional people will find them and follow them. But two, they need to be folks that if I send to the CEO of a health system who I've known for 2 decades, there's certain folks who I just, by the nature of their personality, even if that CEO or that health plan administrator or that investor does not personally put a check into that founder or personally do a deal with them, that they will join team Kim, Yemitze, John, whatever. And it's a backable founder. It's a founder that whose story and whose ethos and whose vibe someone can get behind. And it's tough to quantify, but there's the guy from Vitalodia, Yemitze Calvin. Even before he was an effective business communicator, there was just a personal gravitas of just you want to support this guy. And what ends up happening, now as I've seen play out over years of being a startup operator, is that becomes a tailwind. That he, every other startup founder, you and everyone else that builds in healthcare, there's a lot of suck. There's a lot of you are stuck wading through neck deep mud. But when you have the type of founder who high quality operators will join, and high quality operators will want to support, then that becomes a tailwind and a lift, and it makes those lulls much easier, and that's the companies that'll survive, and that's the companies that make it through.
So my question, I guess, here is: are you supposed to be born with that vibe, or
Absolutely
you can?
Not. So that is a fantastic question, a great spot to end. So I do not believe that I'm an exceptional communicator or great at these things, but there are 3 books that deal with all of this stuff can be taught. And there are 3 books that do a very good job of it from different perspectives. One is The Charisma Myth, which is exactly what it sounds like. The next is Nonviolent Communication. which deals with exactly what it sounds like. And the last is Never Split the Difference, which deals with like confrontational negotiations. I'd say those 3 books would take a founder a very long way towards figuring out what their specific voice is. And if someone's watching this and thinking, oh man, I'm going to pick one of these up, my advice, and I teach a 3-week workshop based on Never Split the Difference. My advice, if you go about any of these books, is one at a time, like read like 1 or 2 chapters, and then just spend a week like implementing that particular chapter of communication into your day-to-day. Like, it will all feel awkward as fuck. But the trick is that like you end up seeing what works and what doesn't, and you incorporate certain framings and communication patterns and like just ways of thinking about your counterpart, and it's all about like a charisma and empathy and being able to respond to both like the hopes and the fears of the person you're working with. But at the end of the day, like, your voice and the way in which you operate and the way in which you move as a founder will be different than mine or anyone else's. And the framework that I've found helps graduate students, particularly scientists and clinicians, get to that is this like, read a chapter or 2, spend a week. Read a chapter or 2, spend a week. And like for me, I read Never Split the Difference probably like 6-7 times. Now I do so like about once a year, but it used to be like every 3-4 months, and it's just like there's just so much value. The same thing goes for nonviolent communication and the charisma myth. The other one I'd put in there is that's much more, we'll say, like startup-y. Like those first 3 are not very startup-y. Mm-hmm. The startup-y one is Lean Customer Development by Cindy Alvarez. So she does customer discovery now at Microsoft. Previously did a number of startups. But the first 3 I think are more important. Though the first 3 are about like interpersonal skills and like how to become someone who like high quality operators are drawn to, and who sophisticated later stage operators want to support.
Awesome.
Cool, man.
Thank you very much.